In the Bono East Region, health authorities in Techiman municipality are working towards stepping up education and sensitization campaigns to have more people accept the coronavirus vaccines ahead of the Christmas festivities. The municipality has, since the outbreak of the pandemic, recorded over 30% of the cumulative number of cases recorded across the region. There's more in the following report.
Ahead of the festive season, the Techiman Municipal Health Directorate is increasing its sensitization exercises across the municipality as a means of curbing the spread of the COVID-19 pandemic. Municipal Director of Health Services, Dr. Kusi Fosuhene, told Joy News that the move is to help have an incident-free Christmas season.
We are very much aware that during the Christmas season, there will be lots of traveling, there will be lots of festivities, programs of various nature, church, religious, social. So as a municipality, Public Health Emergency Management Committee meeting, which is headed by the Municipal Chief Executive, to enforce the existing protocols or measures and then to add on if it's necessary, especially with the Omicron variant around. And of course, I'm sure our enforcement officers will be more visible because we know that during the Christmas time there is an influx of people into the major cities, so they will be doing more patrols and more education in public places so that we all help minimize the spread of COVID, and then we would have an incident-free New Year, hopefully.
He further noted that with vaccine hesitancy, the Directorate is stepping up its education campaigns to have more people receive the COVID-19 vaccines.
You know, as you keep vaccinating, your numbers goes up. Then you get to a critical point where the very willing ones are done vaccinating. Then you start getting people who are a bit reluctant or hesitant to vaccinate, and that calls for stepping up our education. So that's exactly what we have been doing in the past week. We took a break from the vaccination to step up the awareness and the education. As I speak to you, there is another meeting going on in the Brunchampim Hall on vaccine hesitancy alone. These are all measures to step up the coverages for those who may not be so willing like the first numbers we had. So I've been impressed, but there is still more room for improvement.
Medical Director of the Techiman Holy Family Hospital, which is the largest referral center for COVID-19, Dr. Ernest Amiao, noted that the facility is collaborating with the media to increase awareness ahead of the Yuletide.
As media houses, we use them as medium or platforms to communicate and educate, particularly the preventive aspects of this pandemic. And that's how come it became necessary that we met the media today to brief them on measures we have taken as an institution or a hospital to stop the spread of COVID-19, and to also entreat them that as stakeholders, they will give us the opportunity to continue to come to their media houses to continue with the education that we are giving.
He further entreated the general public to ignore the various myths surrounding the vaccines and go for the jabs in order to remain protected against the pandemic.
I will entreat everybody to ignore the myths surrounding the vaccines and to go for the vaccines, because it will protect you, it will protect me, it will protect everybody, so we could curb this pandemic.
Reporting for Joy News, Anas Sabit, Techiman.
Joining me on the phone for more on this is Dr. Michael Owusu, who is a virologist and a lecturer at the KNUST. He is also a virologist at the Kumasi Center for Collaborative Research. I'm grateful for your time, Dr. Owusu. The vaccine hesitancy is deepening, and it's becoming a big issue for the vaccination drive. What can we do to help vaccinate the population? Remember, we are supposed to vaccinate 20 million Ghanaians. As at now, we've done over 7 million. Shouldn't we revise our notes?
Yeah, good evening to you and Good evening to all your listeners. If you remember very well, the very first time that we got hold of a vaccine in Ghana, there was a strategy that we adopted. If you remember, the president was the one that took the first lead, followed by eminent chiefs, and then we had some of the parliamentarians and some of the media people themselves, high-profile people who took the first step, which is what boosted confidence in many people, and then we had many other people now joining. That was the first thing that we crossed, which seemed to stabilize this hesitancy that we had. But after some time, when people thought that this COVID is almost over and everything is fine and people are not dying, people seem to feel that why they need to vaccinate if they are healthy. And also the anti-vaxxers information that they are, it seems to be making things difficult. I think that at this level and stage, we may have to once again relook at that strategy. I know a lot of people have vaccinated, but then there are also many more opinion leaders who we may want to count on to lead this campaign. From the religious side, especially the churches, the mosque, and many other prominent people at various places will have to help us, all of us, to take the lead. And those who are not taking their job, to take their job, full glare of the media, for people to accept and also make it a part of us that this is not something that is going to kill us, but this is something that is going to help all of us. The second level is understanding that just like we can take hepatitis B vaccine every 8 to 10 years because of winning immunity, and just like things like influenza in the Western world, you take it almost every year because of changing mutations in virus. We have to find a way of educating the public to understand that these are viruses that are not stagnant. They are prone to mutations, and therefore taking vaccine doses, booster doses, almost annually is something that we have to become used to. Because it's in the adult population, people don't seem to get it well because children don't talk. So most of the vaccines are given for children, but for adults, this seems to be the first time that we are giving such vaccines for people who can read, can write, understand their rights. And therefore, the communication for people to understand that, look, this is something that we have to live with. And it's possible that every year we have to be taking vaccines like this to enable us be able to boost our immune system against changing strains of the virus. So I think that these strategies will help us. Education and getting opinion leaders to lead this campaign may change the equation and enable us to move ahead in this campaign.
But the new variant, the Omicron variant, we're told has a high resistance rate towards these vaccines. So, I mean, why should we even vaccinate? It's neither here nor there.
Yeah, so once again, this is some misunderstanding that many people have. I mean, the Omicron variant has mutations, yes, almost twice what we had for Delta. And yes, there is one amino acid chain we call the K417N.
Dr. Michael Owusu is virologist at KCCR. He's also a lecturer at the KNUST, and he's been explaining why people need to take the vaccines. I mean, lately, the issue of vaccine hesitancy has been a problem, as the Ministry of Health, Ghana Health Service, intend to do the mandatory vaccination and the compulsory vaccination upon entry into our country. There's been a lot of resistance coming from the public, but Dr. Michael Owusu says it's the surest way to go. Do we have Dr. Michael Owusu back? All right, so when he joins me again, he'll be explaining to us why he thinks we should still vaccinate, even though a research has shown that the Omicron variant is resistant to the available vaccinations. Dr. Michael Owusu, if you're back, you were explaining to me why the vaccination is still important.
Yes, so what I'm saying is that what we know and understand is that the new variants which are coming up, and many more are likely to come up, doesn't reduce the efficacy of the antibodies you mount to 0%. but then it comes down to to a certain percentage. For instance, if Johnson & Johnson gives you 100% protection, and you have a new variant coming in, this protection could be reduced to 80 or 90%. You are better off than somebody who has not taken the vaccine at all, who has 0% protection, and it's more probable that the person has a higher chance of becoming infected, having severe disease. And the good thing is that even if the variants cut down the protection to 80%, a booster dose could still take you back and enable you to achieve that 90 or 100%. This is the same strategy that the influenza virus uses because of shifts and drifts in the antigens. Every year, new vaccines are updated or upgraded so that you can take care of emerging strains and cover the broad changes that occur, so you can be able to keep your system strong. So people should not think that because variants are coming up and vaccines are available, you can decide not to take it. If somebody takes the vaccine, he may get infected, but then he may not have severe disease, he may not die. And if he takes a booster dose, he may still boost his system enough and make his system much stronger and better than somebody who has not taken it. So I think there's a miscommunication or misunderstanding somewhere that people don't seem to get right. And this is what we have to do. And as I said, in the U.S. And the many Western countries, influenza behaves the same way. And COVID or SARS-CoV-2 is likely to behave in the same way. And therefore, booster doses or vaccines upgrading is something that we have to be used to and be taking these things as part of our normal life as human beings as we move on.
Dr. Michael Owusu, I'm grateful for your time. He's a virologist with KCCR and also a lecturer at KNUST.